Bobby here with Guardian Angel Birth Services, and this is my video, as promised, on the 5 points to staying healthy and low risk. So, why do we need to start with this foundation? Well, first of all, I think the majority of couples spend a lot of time diving deep into learning about all of their options, their healthcare providers, where they want to deliver, how they want to do it, all the things, right? But the first foundation that we need to start thinking about before any of that is, are we healthy and low risk? Because healthy and low risk moms have more options and they're able to utilize those options. If you're not healthy and low risk, you can't utilize all of those options for birth and postpartum. So the first thing that you need to be doing is to understand the foundations of being healthy and low risk, and then what you can do to maintain that. Because I think another misconception is that a lot of people think, I'm fairly healthy. I'm low risk. So far, my doctor said so. But the further along that you get into your pregnancy, what most people don't realize is that it's harder to maintain that because the demands on your body are so much greater the further along that you become. So with that being said, let's dive in. You should probably grab a pencil, a pen, notebook to take some notes, because I think you're going to find a lot of things interesting. Okay? All right. So the 5 points to staying healthy and low risk. The first point, number 1, is nutrition. This is the foundation of a healthy pregnancy. The first thing we need to understand is that food is medicine. It is not neutral. Anything that you eat and consume and put into your body is not neutral. It's either going to improve your health or it's going to cause problems with your health. Okay? It's either going to make your body stronger or weaker. Okay? So nutrition is vitally important. And I think we all have a different idea of what that means. What is healthy foods? What is a healthy diet? What does it mean to have good nutrition? Okay, so there's 2 main sources that I talk about in my program. First thing is changing our mindset on what healthy foods are. Depending upon what culture you come from, how you were brought up, those things all influence our thought processes on this. But if we start from a biologically normal viewpoint, foods that are in their wholest, naturalist state as possible, nutrient-dense foods that are just jam-packed with nutrition, avoiding processed foods whenever possible, right? So this is one of the things that I focus on in my program, is just mindset, changing our ideas on that. When we go to the store, learning how to read labels, just learning what healthy foods are versus unhealthy foods. Okay, so that's one of the main things that we talk about. The second principle to nutrition is the Brewer pregnancy diet. This is a scientifically based program that focuses on key points that are essential to the pregnant body. Okay, nourishing that placenta, which then in turn nourishes the baby. If we don't understand those key elements that are ultra important to maintaining a healthy pregnancy and preparing you for postpartum, preparing your baby for life outside the womb, it's not just about growing and keeping your baby healthy and strong in the womb, but a healthy diet during pregnancy extends into that postpartum period. It extends into that baby's life, specifically the first 6 months or so after their life. So understanding what those 3 current key principles are with the Brewer pregnancy diet, which is calories, protein, and salt. And so we dive deep into those concepts, understanding what those are, why those are important to the pregnant body. Other key elements that I talk about in my program are food logging, just getting a base point to start with, to understand what your points of struggle are, what your habits are, where you might have trouble throughout the day, getting in good foods. We talk about putting those foods on a grocery list, right? So if you don't know what foods you need to be eating, if you don't know where you're struggling, if you're not food logging, you can't buy those foods. You're not gonna buy those foods. If you don't buy those foods, you can't eat those foods. If you're not food logging and you don't get a base idea of where you're at right now, you don't know what changes to make. So those are things that we dive deep into with my program, and those are going to be individually based upon each person. Okay. All right. The second point to staying healthy and low risk is physical fitness. Now, what does that mean? So there's quite a few things that can fall into this category. First one would just be regular physical exercise, which is going to be beneficial for just strength and stamina. Okay. Pregnancy and birth place a lot of demands on your body. And there's a reason why we're supposed to be pregnant for 9 months, because you're preparing for a major life event. You wouldn't expect to show up to a marathon, right, without having a good program that you've gone through, focusing on nutrition, having a coach come alongside you and help guide you and keep you on track, right? Keeping you accountable. So physical fitness has to do with just those normal things that we could do, things that you enjoy, walking, swimming, normal physical exercise programs that you might be involved in. But then we also focus on, in my program, pregnancy specific exercises. Okay. And these are going to be specific to what we call targeting the 3 B's. Okay. Back, belly, and bottom. Those are the 3 main areas that a lot of strain and stress is placed upon throughout pregnancy. And those are going to be the major areas where you're going to find that you're going to need to be toned and conditioned so that you can adequately function during birth and then heal optimally postpartum. So we go over in my coaching program every single week, different positions, different techniques, different coping ways or problems that you might have as far as like your physical limitations, all of those types of things. And then there's going to be other things that are going to impact optimal fetal positioning for baby. So it's not just about your body, it's about baby's comfort as well. So most often, if mom is uncomfortable, baby's going to be uncomfortable, and vice versa. If baby's uncomfortable, baby's going to shift and turn and choose positions that aren't going to be comfortable for mom, and that's where a lot of the pain comes from too. And then just the normal hormones and things that are happening in pregnancy, those softening hormones. It's so much easier to pull a muscle or to be uncomfortable because of those extra demands on the body. So understanding that, listening to your body, and then responding and doing the things that can help alleviate or sometimes even completely get rid of unnecessary pain. Okay. And then the other things that are going to fall into this category of physical fitness are going to be lots of body work modalities. Okay. I am a huge proponent of, for example, chiropractic care, massage therapy, physical therapy, reflexology, craniosacral therapy, pelvic floor therapy. I mean, there's so many wonderful practitioners and modalities that we should be taking advantage of throughout our pregnancies, just for optimal, again, like I said, optimal comfort, optimal positioning for baby, just optimal health, physically, structurally, for our bodies. Oftentimes we think of some of those things like going to get a good massage. We think of that as like a special spa treatment, right? But we really need to shift our mindset away from that and understanding that those things are really crucial to our overall health, physically, mentally, emotionally. If those things are going to make us feel better, again, our bodies are going to be more comfortable and our babies are going to be more comfortable. Okay, so there's a lot of key things that really fit into that category. And in my coaching program, we just go over again individually what your needs are, what different modalities you might want to take advantage of, and how those can affect you and benefit you. And so we tailor all of those things individually and figure out what your needs truly are. Okay. Third point is going to be relaxation. So I'm not just talking about sitting down in front of the TV, enjoying a movie together, or a good book, or going for a walk. Those are all things that are certainly very relaxing and that we need to make time to do for ourselves. But when I'm talking about relaxation as this third point to staying healthy and low risk, I'm really talking about very specific techniques, okay? And techniques that are going to target three specific areas: the physical. So is mom in a good optimal position that is conducive to good positioning for baby? Is she in comfortable positions? Is she utilizing good posture? How is she being touched? So as a partner that comes alongside her, as a doula, or other people that are involved in her life, other practitioners that are coming alongside to work with her, whether it's throughout pregnancy or birth, okay, and the postpartum. Does she like how she's being touched? Does she like where she's being touched? Does she like soft touch? Does she like hard touch? Utilizing counter pressure points. I mean, just how she's physically feeling, the clothing that she's wearing, the temperature of the room. I mean, just being aware of all of the five senses. Okay, so physically, there's a lot of things that we can talk about just within that category under relaxation. Okay, and then secondly would be mental. So this has to do with mindset shift. Okay, what are your thoughts? What are your viewpoints? What are your biases about all of these things? About even just the concept of birth, of pain, of the whole process of labor. That all depends on your knowledge base first, but then your mindset surrounding that. So things that you think about, the stress that you're carrying with you throughout the day, just the different stressors in your life that even have nothing to do with pregnancy, birth, or postpartum, but just life in general. That affects mindset, that affects our stress levels, right? Which in turn affects our physical health, physical well-being overall. So with the mental, we work on all of those different things and just changing our mindset, focusing on the positive, focusing on, as partners, what things can we do and say to moms to encourage her, to bring her back to that positive place, to protect her from maybe negative influences or negative things that people might say. Okay, and then the third point under relaxation is going to be emotional. So that's an emotional response to the first two, to the physical, to the mental. How is she responding to those things? Does it make her happy? Does it make her feel safe? Does she feel secure? Does she feel loved? Does she feel protected? Does she feel supported? Is she fearful? Is she scared? Is she upset? Okay, so that has a lot to do with mindset shift as well. But honoring those emotions, okay, not dismissing them, validating them, talking through them, having that support team that comes alongside of you to help you work through those emotions, not ignoring those. That is so key. And a lot of times I think people tend to do that. We're just not in touch with our emotions, and we really do need to honor those and work through those and figure out where those emotions are coming from, and then supporting those and nurturing those emotions. So as you can see, point number 3 is jam-packed with so many different topics and so many different things that we can be working on. And certainly in my coaching program, we spend a lot of time every single week just on this topic alone and figuring out what your unique needs are. Okay, diving deep into personality and style and all of that stuff. All right, as you can see, I'm just checking in with my notes here because I have a tendency to really get off on tangents because I'm so passionate about these topics. So I like to keep myself on point. Okay, so we've gone through 3 points. We're on to point number 4, which is responsibility, and that's about stepping into your power. Okay, I help powerful people, powerful moms, powerful dads, powerful couples to realize their power and just how powerful that they are and how more powerful they can be. So stepping into your power has so much power in and of itself. That's why it's point number 4 to staying healthy and low risk. Understanding that you have so many choices, okay? There are a lot of things in life that we can't control. We can't control our past genetics. We can't control where we've come from. We can't control, a lot of outside sources that may affect our health. But we can control how we respond to those. We can control our choices surrounding those things. And so it's so culturally, I think, a lot of times opposite where we are in the United States here, is that we are surrounded by so many options, so many resources, and that can be so overwhelming. And so sometimes it just seems easier to just have someone tell us what to do, right? Like, choose a healthcare provider and then you just tell me what to do, what test I need, what procedure I need, what my next steps need to be, what I need to be doing for this or that, because the other option would be to weed through all of that and make a choice for myself. And then that can be overwhelming. But then also, I think another reason is that sometimes we don't want that responsibility, because then we feel like if we make the wrong choice, then we're to blame. And so in my coaching program, my goal is to really help you to step into that power and to own it and to be proud of it, and to take back the power that maybe have been stripped from you in the past or the present, and to realize that, this is your body, this is your baby, this is your family, and these are your choices to make. So avoiding unhealthy choices, avoiding unnecessary interventions, unnecessary procedures, making the best informed choices that you can. And you can't do that unless you do point number 5. And point number 5 to staying healthy and low risk is education. Okay? Let's face it, we are bombarded with resources everywhere, just at the click of a button, right? We can get on Google and we can look up anything, and we are going to have a multitude of answers. And that in and of itself, again, can be really, really overwhelming. Okay? So it's hard to weed through a lot of that information and definite misinformation. There is a lot of misinformation. We have to remember that a lot of the information that is available to us is merely opinion, okay? And while opinions can be useful and helpful, we really need to be focusing our attention on the evidence-based information, to the foundational concepts of what is biologically normal and healthy. And when that comes to pregnancy, birth, and postpartum, there's a lot of controversy around these topics. There's a lot of controversy around just health in general. And I think the one statistic that I would like to share, and there's so many statistics I could share surrounding birth, but the one statistic is I just want to share, just in regards to health in general, in the United States, we rank 39th for overall health. This has nothing to do with pregnancy, birth, and postpartum. Just overall health, we rank 39th, which means 38 other countries do better than us. If that is not enough to spark a fire in you to step into your power, to learn why, and to educate yourself, which in turn is going to release a lot of that fear and anxiety that you may be having, around this topic, which is so brand new and unknown to first-time parents, or fear and anxiety around this topic because maybe you're a repeat parent and things did not go how you had planned the first time, or your desires and wishes were not honored, or you just were not informed enough. These statistics, that statistic alone, should spark a fire in you to step into your power, to educate yourselves, and to educate yourselves with good quality sources. And this is another thing that is really useful about my program, is that I have done a lot of that weeding out for you. And I've created a lot of good resources that you can kind of start with to educate yourselves and research. Again, coming from a biologically normal, evidence-based standpoint. Okay, so those are the 5 points to staying healthy and low risk. And just want to make sure I'm not forgetting anything here. So recapping: nutrition, physical fitness, relaxation, and don't forget, within that category, we've got mental, physical, and emotional. Okay? Number 4 is taking responsibility, stepping into your power. Number 5 is education. So within those 5 points, nothing about this is easy. There's a lot of jam-packed counterpoints, extensive points, a lot within each of those points that needs to be discussed and talks about. So this is something that I do in my program. We dive deep into each one of these points, and I take you on a journey, on a transformation, if you will, from a point of possibly fear, confusion, anxiety, stress, and maybe sometimes even just the starting point is just excitement. Like, but pregnancy brings excitement, right? Preparation for birth, it's exciting. But I don't want you to discount how much work is truly involved and what we're truly up against in our society, in our culture here in the United States. And it really does take a lot of work, a lot of planning, a good support system to come alongside and help guide you. And so that's what the name of my business is Guardian Angel Birth Services. Because I act as your guardian, if you will, to come alongside you, educate you, help nurture you through these different choices that you have, help you come up with a plan of action to implement all of the things that you're learning so that you are set up for success and to feel prepared, confident, empowered, experience optimal health, to be healthy and low risk so that you have the best chance at succeeding with your goals. So if you're not following me yet, I'm Bobby with Guardian Angel Birth Services. You can find me on Insta, Facebook, YouTube. If you're not following me yet, please like, follow, comment, share with others. And I would be happy to get on a call with you and discuss your goals and your dreams and your desires and your fears with you and see if my program is the right fit for you. So like, follow, share, get in touch with me. I'd love to talk with you. Until next time, bye-bye.